Hello, I'm Dr. Syed Raza and I work as a consultant cardiologist and physician at Awali Hospital in Bahrain. In the next 10 to 15 minutes, I'm going to discuss as to what are the organs that are involved in COVID-19 and its related complications. I'm briefly going to touch upon the rehabilitation measures, particularly focusing on the holistic approach in managing these patients. So we all know the COVID journey. It starts with when the virus enters your body and primarily it affects your lungs. And then it also affects the other organs or systems of your body. Majority of the patients, at least 85% of them, will have only mild symptoms, meaning thereby they will have just fever, cough, sore throat, tiredness or fatigue that would require only outpatient management. So they go to outpatient, they get some medicines, and they are discharged home and treated at home. Now, some of them would require hospital admission, and these are the patients who would either require oxygen supplement or they will require some intravenous antibiotics and some of the medications or drugs that can only be given as inpatient. These patients again may recover and they may go back home to their loved ones. But some of the patients are not lucky. Unfortunately, they do become more serious, their health or the condition deteriorates, and they may end up in more intensive care setting like intensive care unit or high dependency units. They will require more advanced care in the form of the medicines that will support life. They may also require what we call artificial ventilation that would give oxygen under a lot of pressure using a machine. But a small proportion, unfortunately, will not make it fighting this battle with this corona or COVID virus. Now, we all know by now that lung is the most important or the primary organ that is involved in COVID-19, but there are other organs which are involved as well. The second commonest organ is the heart, followed by brain, the kidneys, the bowel, the liver, the skin, you just name it. Now, I get asked this question very frequently by my patients and relatives and friends that could my heart be involved if they have suffered COVID or COVID-19? So what are the ways in which the heart can be involved in COVID-19? One of the ways is that it leads to inflammation in the inner lining of the heart vessel, and that is something what we call the plaque that may be disrupted, they may break off, and they can cause the obstruction or occlusion of the lumen of the coronary arteries that supply blood to the heart muscle. This will cut off the supply of oxygen and blood, and that will lead to what we call heart attack. The other way it can affect heart is COVID-19 infection increases the thickness of the blood. This blood will easily clot inside your heart arteries, once again cutting off the blood supply and oxygen supply to your heart muscle, and can again lead to heart attack. The less common way is when the COVID-19 virus will attack the heart muscle itself. It will cause inflammation in the heart muscle. This heart muscle gets weak, it does not pump efficiently, and then it can lead to what we call heart failure. And all of them can also lead to abnormalities in the electrical signals in the heart, or in layman term or simple term, we can say it causes electrical malformation, in which the heart may either beat very, very fast, giving rise to what we call abnormal rhythm, arrhythmia, or the heart, in some rare instances, will start to beat very, very slow, and may require some boosting by instrument what we call pacemaker. Now there are different phases of COVID-19 infection. Acute COVID-19 is the phase of infection where the signs and symptoms of COVID-19 they persist for up to 4 weeks. Now beyond 4 weeks, between 4 weeks and 12 weeks, if these signs and symptoms persist, then this is called ongoing COVID-19. And beyond 12 weeks or 3 months, if these symptoms or signs persist, then this is something what we call long COVID or long COVID syndrome. Now, long COVID syndrome, it has got a wide variety of signs and symptoms. Now, the commonest is, as you can see here on the diagram, is fatigue. This is followed by breathlessness, and there are then less common symptoms like headache, runny nose, loss of taste or sense of smell, sore throat, cough, diarrhea, joint pains, and so on. COVID infection is surely a reason for anxiety. And what are the reasons where the patient will become anxious? Number one is being infected by COVID-19 itself. Now, why the patients become very anxious, why they become very worried? For simple reason that they do not know what the outcome is going to be. And there is a fear in everybody's mind that it may lead to worse outcome and it may even lead to death. So that is the fear in everybody's mind. And that is again a very common cause for anxiety in patients who are suffering from COVID-19. Now the patients who are not infected, they may just be exposed. They also become very anxious for a reason that they are confined to isolation for no fault of theirs. They may be just exposed to someone and they get isolated to prevent infection in case they are infected to their loved ones. And that is again a very common cause for anxiety. Obviously, whether a person is infected or exposed to COVID-19 restricts them from doing their day-to-day activities, engaging in social activities, participating in forms of entertainment, and so on. So there are ways to return to normal self, and this is what we call rehabilitative measures that can be taken for a person to return to their normal self if they have developed COVID and if they have recovered or are already recovering. So first and foremost that they must eat healthy. And what they must eat, obviously COVID-19, if it has been a prolonged illness, particularly for those who have been admitted to hospital or have been admitted to intensive care, obviously that the infection leads to loss of appetite, the intake is reduced, they may lose their muscle, their bones may become little weak, and overall they may lack energy. So they must take very nutritious food. They should take high intake of protein that will help for them to build their muscles that they have lost during the course of the illness. They should take plenty of fresh fruits and vegetables, but they should avoid sweet fruits that are high in sugar. They should avoid high carbohydrate intake. When it comes to exercise, obviously we cannot tell a person to do jumping jacks, as you can see, or somebody jumping and doing marathons. So person or the patient has to take it easy. They are advised to do exercises in small increments. They may just exercise for a few minutes and they may increase the intensity of exercise gradually. They should stop exercising the moment they feel that it is exhausting them and they become unduly fatigued. Certainly, they are advised that they should include deep breathing exercises in their exercise regime. Now, lung, as I said, is a common organ that is involved in COVID-19, and to prevent the complications of COVID-19, one of which is fibrosis, where the lung tissue, they become a bit stiff with the infection, and it is the deep breathing exercises that will help to open up the bags, you may call it, inside the lungs, that will help to fill in the air, and that will help somebody to breathe well and provide the oxygen, enough oxygen to the rest of the body. Now, you may have heard eating various things that boosts your immune system, and these are some of the things that you can see. These are the berries, green tea, and these are the nuts, and obviously the citrus fruits, they help and they go a long way. That would boost your immunity. Now, there is no scientific evidence as to how much they help, but certainly they can be tried. Smoking should be discouraged, and if somebody is still smoking, because lung is a common organ involved and smoking does affect the lungs, then certainly they should be advised to quit smoking, and they should also limit or stop drinking alcohol completely. Now, we have all learned all the way during this COVID pandemic to maintain the social distance, but I think this is a wrong term. It's a misnomer. We should not maintain social distance, we should maintain physical distance, but we must be socially connected. We should come socially close to each other. And this can be done by using various methods and means. It can be by telephone, by text messages, by social media, Facebook, Instagram, and so on. One most important thing that we have seen during the COVID pandemic is people getting the information from the wrong sources. Yes. So please do not meet Dr. Google before you meet your real doctor. So please stay away from information that may not be true, it may be misleading, and also it may also be sometimes dangerous. COVID-19 vaccine is the best weapon that can help you to fight this infection. It can help you to prevent hospitalization due to COVID-19 infection and can also prevent death from COVID-19. So please, if you have not taken COVID-19 vaccine, if your loved ones have not taken COVID-19, then I urge you to book yourself for COVID-19 vaccine as soon as possible. Now, during this COVID pandemic, we have still been wondering as to who is stronger and smarter. Is it the COVID virus, or is it the human being with the COVID vaccine? Now, certainly we have realized that whatever your position or designation may be, no matter how powerful you think you are, no matter how rich you are, how much money you have in your bank account, and no matter what position you have been holding, certainly COVID-19 disease has made us realize that we are vulnerable. Yes, we are all vulnerable. But at the same time, the COVID-19 infection has also made us more resilient. COVID-19 infection or COVID-19 pandemic has helped us to fight back, to bounce back, and to get ourselves on the track to normalcy. COVID-19 has brought about a big change in our life. It has made us think differently, it has made us work differently, it has made us socialize differently. It has also made us change lots of policies and procedures. But beyond that, I think it has also helped us to feel more connected socially. I certainly have attended a lot of social events on the virtual or social media. I've attended birthday parties, graduation ceremonies, wedding ceremonies, and I'm sure many of them have done the same. At the same time, COVID-19 infection has also made us a little bit more spiritual. Yes, we have become a little closer to God. We have started asking help and sometimes also mercy from God to help us overcome this worst pandemic that the, 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 the current generation has seen, and the worst crisis which the generations will remember for. So finally, I would like to conclude and summarize that COVID-19 is a multi-system disease. We all know that it involves the lungs, but it does not spare any of the other organs in the body. Long COVID syndrome, as I mentioned, is a constellation of signs and symptoms that persist beyond 3 months of COVID infection. It can persist for 6 months, 9 months, and even 1 year. Post-COVID rehabilitation is important. It should not be ignored, and obviously it should be done with a multidisciplinary team approach. And finally, we now know that COVID-19 has taught us many lessons, some good and some bad. With that, I thank you very much for your patient listening.